What's the future for migrant care workers in the UK? If you are a care worker interested in migrating to the UK, this video's for you, as it includes the latest news regarding the UK health and care work visa that you should be aware of. Drop all your queries related to UK visas in the comment section below, and we'll make sure to answer them all in our upcoming videos. So don't forget to hit the subscribe button and press the notification icon so you don't miss any updates. The UK Home Office added a new category of care workers to the UK shortage occupation list on the 24th of December 2021 under Soc Code 6145 care workers and home carers. As a result, care workers from different countries have the option of applying for a skilled worker health and care visa, with a time limit of 1 year starting from the 15th of February 2022. Now, the only question that people seem to be asking is what happens to the care workers after the 15th of February 2023. The Home Office has not answered this question yet. However, it seems that the Soc Code 6145 will continue to be a part of the shortage occupation list, because there is an alarming shortage of care workers in the UK. Let's take a look at how the MAC reviews the adult social care in the UK. The Migration Advisory Committee's, also known as MAC, review of adult social care in the UK was published in April 2022. In case you are wondering, the Migration Advisory Committee is an independent entity that is sponsored by the Home Office. It is responsible for advising the UK government on a variety of migration problems. As per the report issued by MAC in April 2022, the social care sector in the UK is going through a hard time because it is unable to meet the rising demand for social care services. The country is facing workforce shortages and budgetary limitations in the social care sector. Needless to say, these problems have escalated even more because of the pandemic. According to MAC's predictions, the social care sector is going to need an additional 236,000 FTEs in the next 11 years to fulfill the rapidly growing demand for social care services. So what are the recommendations of MAC on the health and care visa? MAC's review of the adult care sector pointed towards severe staff shortages, compelling the committee to make the following recommendations concerning the health and care work visa to the UK Home Office. MAC recommends the UK government to launch a fully funded minimum rate of pay programme for care workers in the UK. This will be funded through public funds, and it will be above the national living wage. MAC recommends starting this programme at a minimum of £10.50 per hour, which should be implemented right away. MAC also recommends that social care workers should get paid for all the hours they spend at work, even if they spend that time sleeping or travelling. It claims that social care workers are not being compensated for their time adequately. Moreover, if public funds are utilised for providing care, it is vital to increase those funds to take all additional costs into account. MAC also recommends the exemption of health and care work visas from the immigration skills charge. The committee also claims that it is time to review the ISC's implications on the entire skilled worker route, as the immigration policy and its objectives have gone through multiple changes since its introduction. In addition to this, MAC has asked the government to carry out thorough research to see if there are any administrative burdens faced by workers and employers in the skilled worker route that could be eliminated. The recommendation of keeping the existing salary threshold for the health and care work visa at the same level has also been put forward. MAC believes that the annual salary thresholds must not be allocated for part-time workers on the health and care visa. No changes to the English language requirements for migrants on the health and care workers route have been recommended. Based on MAC's recommendations, workers on health and care work visa, who complete 5 years in nursing or caring jobs, should be entitled to a complete settlement fee waiver, or pay an amount that's not higher than the processing cost of a unit. It should be noted that this recommendation does not apply to the fee of other types of visas. It further recommends the review of the application fees of all visa types to make sure everyone finds it affordable, including those with middle and low incomes. MAC has recommended that the health and care work visa should become a permanent option for eligible care workers instead of having an expiry date. Furthermore, MAC has asked the government to let care workers stay on the shortage occupation list till the next review is published with more recommendations. MAC has also encouraged DHSC and DAS to collaborate with local authorities to assist in the development of an environment that enables people to use an agency to offer sponsorship to a specific care worker. The government can also launch a pilot umbrella scheme in which sponsorships are offered to international care workers. It will also allow individuals who require care services to recruit workers through the umbrella body. What can we take out from the MAC's review on adult social care? It is safe to say that a lot of publications talk about the staff shortages in the UK adult care sector. The House of Lords was scheduled on the 15th of December 2022 to discuss the problem of worker shortage in the NHS and social care sectors. The UK government appointed MAC in September 2022 to conduct a review of the shortage occupation list, which is not completed yet. The shortage occupation list includes the care workers and home carers since the 15th of February 2022. This change has been introduced as a trial for 1 year, but MAC's review of the list, coupled with a few other reports, shows that care workers are going to stay on the shortage occupation list in the future. However, the Home Office is yet to announce its final decision. We have reached the end of today's video update. Like, share, and subscribe to our channel for the latest updates. Thanks for watching.